Okay, I'm going to start us off. It's 5:05. I hope that everyone has had an opportunity to join us, to join the webinar, and I just would like to extend a warm welcome to all of our participants this evening and a huge amount of gratitude to our speaker, Dr. Epps. We're so excited that she has joined us this evening, um, and as well as our community advisory board. They really set the tone for us and sort of guide engagement at the community level that we do and sort of guide our purpose in this space. So we're extremely excited that to be joined by our advisory board members, but also our keynote and guest speaker tonight, Dr. Epps. Just to give everybody a sense of our discussion, I'd like to just walk through our agenda. My name is Dina Darlington. I'm the founder of Links to Equity, and I've been working in this space for a little bit over a year to engage at a community level, Alzheimer's disease awareness. And we can talk a little bit more, sort of the impetus for me to be a spark in this space. As I mentioned, Dr. Fayron Epps, she's the founder and leader of Alter Dementia. And just to give you a sampling of Dr. Epps, one of my team members went to her annual conference last year and came back and said it was the best conference she had attended all in her entire career. So I think that that just gives you a sense of how fortunate we are to have Dr. Epps with us this evening to talk to us about her work, her focus in faith-based communities and Alzheimer's care. And then we'll have a interview with Dr. Epps. I'm super excited about having the opportunity to interview her. We'll do a Q&A session with her, so you all are welcome to put your questions into the chat or to the question box, and we'll pull those questions and make sure that we have enough time for Dr. Epps to respond to any questions that you may have. And then we'll move into a community discussion. A number of you shared some really excellent questions with us prior to the webinar this evening. And I think you have a great participants on this webinar that can really provide you with some good insight on the questions that you raised. In addition to those questions that were raised prior to the webinar, I'm going to use those first, but then I'd love to just hear any community questions that may be out there as it pertains to either the interview that we had this evening or just in general, any challenges or struggles that you may be going through as you're supporting someone living with or a loved one living with Alzheimer's disease. So we'd love to support you. And again, I think we have the right individuals on the call today to really be able to support you. And then we ask, as usual, that you take a survey. We'll typically have the QR code up for the survey prior to the end of the webinar so that you have an opportunity to respond to a few questions. And the whole goal of that is to improve the work that we're doing, to identify maybe potential speakers or a different focus in Alzheimer's disease that you may want to look at in future webinars. So we really appreciate your insights and your feedback. So please complete our surveys, and then I'll just provide some closing remarks. To tell you a little bit about Links to Equity, we are a strategic consulting boutique firm in Washington, D.C. We focus on policy issues, but we try to bring solutions as it pertains to those issues impacting or having a greater impact in Black and Brown communities. Alzheimer's happened to be one of those disease states that we are focusing on and working with community to remove the stigma around that particular disease by talking about it and by better understanding your needs in that space. So we really try to identify those issues that we can support at a health equity level, but we also provide support at an access level, at a value level, and at a policy level. So we really try to support at a patient advocacy level, but we also work and engage with our industry partners as well as our patient advocates. My team is the reason we're here tonight. They are just amazing, and that it starts with Catherine Oxel. She's our Director of Strategic Operations. I'm sure many of you may have touched her in this process. We're so excited that Joe Coe is with us as well. He's our program consultant and really is very integral in this evening's discussion. And Gina Hayes Sanders has been just an amazing partner with us over the years and really helped us to get where we are today. And we continue to lean on Gina and her engagement on Alzheimer's disease and community has just been so rich. And we're, again, very grateful for her engagement and her partnership with Links to Equity. And then next, our advisory board members. We talked a little bit about why we're here, and a big piece of the reason we're here is to reach individuals in Black and Brown communities across America. And we need a guiding light or North Star in that process. And we are just blessed to have key advisory board members who, as I mentioned earlier, really drive the work that we do, help us identify key areas that are important to them, but also allows us to partner with them and their community. So very grateful. We work with folks from Kentucky, Tennessee, Maryland, Washington, D.C., North Carolina, and Georgia. So, and these are the leaders from those areas that really allow us to tap into their communities. And as I mentioned, guide our work that we do here at Links to Equity from an Alzheimer's standpoint. And, before we go any further, I think it's important to hear from one or two of our members. I know that we have Pastor Owens, Pastor Thurman, and Jacqueline Lee. Jacqueline is the president of the Links in Kentucky. Pastor Owens recently retired from Shiloh Baptist Church, and Pastor Thurman, and is also a pastor at Zion Baptist Church, but also the president of NADVETS, the National Association of Black Vets. Can we just have a few words from the three of you to kind of talk to us a little bit about the work you do, but more importantly, why do you think it's important that your organization is engaged on this important topic of Alzheimer's disease? Oh, and we also have Cheryl Tier. So thank you so much for being with us this evening, Cheryl. Cheryl is the president of the Washington, D.C. Links, and we're super excited to have her with us as well. I'm going to ask two of our leaders or our advisory board members to say a few words. I'll start with Pastor Thurman. You were not with us on the last webinar. If you could share a little bit, and then also Cheryl, I hate to put you on the spot, Cheryl, but just very briefly. You do such amazing work. We'd love to hear your voice as well.
Sure. Are you able to hear me?
We are.
Oh, great. I'm having technical difficulties, being technology challenged anyway.
That's
Yeah, I've pastored the Zion Baptist there. It's a small rural church there in Paris, Kentucky. And then I'm sort of hit by a triple whammy. My ex-wife has dementia, and my two oldest daughters are working with her between Cincinnati and Lexington, Kentucky. And then I had a brother-in-law, one of my sister's husbands, to pass from dementia, and another sister who is dealing with it right now, and her husband. And of course, my head usher in my church had it. So it was just a natural fit for me to get in on this community engagement and outreach aspect of Alzheimer's and dementia when it was presented. So it was a natural fit for me. And of course, I deal with a lot of veterans my age during the Vietnam and Korea era, and many of them are suffering for it as well. And in our communities, particularly Black and Brown communities, we're sort of been put on the back burner, so to speak. We're not apprised of all the resources and all of the things that we can bring to bear to help us as caregivers when it's forced upon us. So this was a natural fit for me, and I am so glad that Sister Haynes Sanders, Gina, brought it to our attention because this worked well for many of us here in Kentucky.
Thank you. Jason, I asked that if maybe we can mute that person, that would be good. And I would like to thank you, Pastor Thurman, for sharing with us. We greatly appreciate those introductory words and understanding why this was so important for you to be a part of. And then I'm going to move to Cheryl Tier, and then we'll jump into our interview. Oh, you're on mute, Cheryl.
Oh, thank you. That took a
There you
minute.
go.
Greetings, greetings. I am at a conference in a hotel out in Chantilly, Virginia. So I apologize for any background noise you may hear, and I will put myself on mute. But on behalf of the fabulous Washington, D.C. chapter of the Links Incorporated, I want to thank my chapter members. I want to thank the members of People's Congregational Church. I want to thank the members of my community, Shepherd Park Community Association. And I want to thank my husband's Kappa chapter for making sure that they are on here, spreading the word and spreading the word throughout the community. Alzheimer's is a disease that touches all of us, and we can never learn enough. So with that, I say thank you. This is important. Let's go forward.
Thank you, Cheryl. All right, we're going to do exactly what Cheryl said, and we're going to move forward, and we're going to talk a little bit about sort of how our in-person outreach impacts our digital outreach. Communication is very important as we're trying to engage at a community level, and we have to take several different approaches for that. We need to do that and that important in-person outreach where we're actually working with our community leaders to make sure that we're doing in-person outreach with them, with their organization, and we are constantly raising that as an opportunity for us to be better partners in person, and whether that takes the form of faith-based barbershops, beauty salons, civic meetings, community health fairs, anything at a local community level. We believe that that's just as important, if not more important, than doing what we're doing right now today. But we recognize that we can't always be at the same place at the same time. So we're really able to have a much broader reach when we're able to have our digital outreach and our community webinar series. So we appreciate you all taking the time and to spend with us today. And we're just gonna jump right into the discussion. I mentioned a little bit earlier that I was going to talk a little bit about why Alzheimer's disease is so important to Black and Brown communities, just to give you a bit of context. And by the year 2030, nearly 40% of Americans living with and Americans diagnosed with Alzheimer's disease, I should say, nearly 40% of those folks will have Alzheimer's disease. So that's a pretty significant percentage in our Black and Brown communities. And we think it's very important that we educate our communities on the disease, the resources associated with those disease, support for caregivers, as well as those folks living with Alzheimer's disease. And that's really why we wanted to bring this series to you all at a community level. We wanted to share lived experience with the disease, and I think each and every one of you can share that with us as we when we go through our Q&A, when you raise questions. Your lived experience is the reason why we're here. We want to know more, and I think that we've done a lot of follow through on those lived experiences. Pastor Thurman mentioned his lead usher was diagnosed with Alzheimer's, early onset Alzheimer's, and we worked with her to do an article in Essence Magazine. So we're so proud of that work, and we're so honored and proud that she stood up and had the courage to share her early onset diagnosis with us so she could be a beacon and an example for others. So we're very grateful for that. We also know that it's very important to foster trust with key stakeholders. We have to show the community that we are partners that they can trust. so that we can continue to provide and do the work that we're doing, but also provide the opportunities that we're doing. And we also want to identify targeted solutions for our caregivers, local organizations, and patient, exchange information at a community level, and provide a platform such as this webinar this evening where folks can participate, learn, ask questions, and really have a stake in the ground around this disease, but also what are the resources that they can use to help them living with this disease. So without further ado, I'm going to introduce our speaker. I am, as I mentioned earlier, just thrilled that we have Dr. Fayron Epps with us this evening. We're going to conduct an interview with her. She's a nurse and a researcher specializing in gerontology, dementia care, and health disparities. She's a professor and the Karen and Ronald Herman Distinguished Chair in Caregiving Research at the University of Texas Health Science Center, San Antonio School of Nursing. She centers her work on promoting awareness, education, and support for families affected by dementia, particularly within African American communities. Dr. Epps is known for her community-engaged research and her efforts to partner with faith communities to improve dementia care and resources. Her research includes exploring how faith-based organizations can serve as a system of dementia care for families and caregivers, and developing culturally relevant resources to address health disparities and dementia care. Her work bridges the gaps between research and real-world application by ensuring that her findings directly benefit the populations she serves. She has received various accolades and funding for her innovative work in health equity, dementia care, and community engagement. So without further ado, I'd love for Dr. Fayron Epps to introduce herself, a little bit about herself, and then I'll jump right in to an interview. But I think it's important that we have a few words hear a few words from her personally.
Thank you so much for that introduction. I mean, you summed it up in the bio, but good evening to all. Thank you all for taking our time to learn more about this important topic. A little bit more about me. I received my education from Tuskegee University, Southern University. So I always put that out there. I am a HBCU grad ×2. And a lot of my work has been, my career is in nursing for over 25, this year makes 25 years that I've been a nurse. But one of the most important things I need to let you all know that I'm a woman of faith. And I always make sure that I let the audience know that before I start speaking, because that is the lens that I will be approaching your questions, you're answering your questions with. My work that I am doing has turned into my ministry. And I'm just so excited to say now that I'm walking in my purpose. I'm being able to serve his people through my research, through my service. And that kind of sums up what I do and why I do this every day, 24/7. They ask all the time, when are you going to take a break or a vacation? But I can't, because I know work needs to be done. And I need to make sure that I get these resources out to our communities that really need it. And that's my biggest thing, y'all. When I started doing this work, I first of all, 10 years ago, I've been in the dementia space, and I didn't know dementia disproportionately impacted the Black community the way it does. And I was a nurse working in nursing homes, the hospital. But it wasn't until I picked up the Facts and Figures report that I seen that we were hit, the Hispanic community was hit, Hispanic Latin community was hit, and I had no clue. And I thought about it and I said, well, nobody in my family has this. None of my friends, they're dealing with this. And I said, you know what, let me find these families. And I'm originally from New Orleans, and that's where I started this work, was looking for families that were on this journey, particularly Black families, so I can learn from them and I can see what this was. And I will tell you all, I was surprised. Because remember, I said I didn't know anybody. It wasn't personally affecting me. But when I put it out there, what I was doing, I had friends that we used to go out that shared, oh, my mom has Lewy body dementia. And I'm like, your mom? And I come to your house frequent and I didn't even know. Again, people that took care of my kids said, oh, my Fayron has this. And again, we do not talk about this. And this was 10 years ago. And I'm trying to change that for us to have these conversations. Because once I found out and I learned what they needed, I was able to provide more resources to them because I was working in the university system and partnering or volunteering with the Alzheimer's Association. Personally, with my family, my mom said, oh, that's for white folks. We don't get that. But as I learned more about the signs and symptoms, Alzheimer's Association has a great pamphlet, the 10 warning signs of dementia. And when I went through that, I was like, I think my aunt so-and-so got this. And you know what my family told me? No, she don't. She's been contrary all her life. That's just what that's how she do. She lock herself up. She just mean like that. That's what. But come to find out, she died in her home by herself because no one, we just let her be because that's how she was, quote unquote. But when I talked to her daughter afterwards, I said, you know what? I really think your mom had dementia. You know what she said? Oh, she did. And I said, but you didn't tell anyone? And she lived 3 states away. I said, you know, my other aunt would have came and made sure she checked on her every day. But again, we do not talk about this. So I'm so appreciative that you all are doing this series so we can have this conversation. And I will tell you all right now, we no longer can be silent. And I appreciate each one of you all being here so we can learn how to have these conversations with our family, our friends, our coworkers, our church members, with our doctor. We just cannot keep being silent. We need to be able to speak about this, be knowledgeable, be empowered, so we can have change. All right, I'm sorry, I'm gonna stop.
No,
I know you got
no, Dr. Epps, that was perfect. And you make me want to share. So, my dad had dementia with Lewy bodies, and my grandmother, his mother had Alzheimer's, his sister had Alzheimer's, his niece had Alzheimer's. So I think it's so important that we talk about this. And because it gave me knowing that, put me on alert, of what I need to be mindful of and what I needed to do. So I appreciate those pearls that you just shared with us. And I'm gonna, you may have answered my first question, you may have, but I'm gonna just put it out there just in case there's more to it. So I was gonna ask you, what made Alzheimer's this focus for you, one, and then B, your brilliant idea to bring it to the faith-based communities and combine those two under your work at Alter.
Yes, so I think when I mentioned, I will tell you I was writing for my to get a postdoc. And they say you need to focus on something. So family caregiving has always been my thing because it's really prominent in my family, my maternal and my paternal side. We always about supporting our grandmothers, our elders, we're there. And we do it with joy. Well, my mom's side did it with joy. My dad's side, not too much. But that was really embedded in us. But when I was writing for a postdoc, they said, well, it needs to be caregivers for a specific disease or illness. And that's when I picked up the facts and figures. And I was just picking it up. I didn't expect to see anything in there. And that's when I seen those statistics that African Americans were twice more likely than their white counterparts to be diagnosed with a form of dementia, or some people say Alzheimer's disease and related dementia. I was shocked. And that's when I said, wait, if this is really attacking my community, I need to do something about it. And that's when I started to meet families. I met 18 families in the southeast region of Louisiana. They opened their doors. I came in there. I sat down, ate dinner with them. Like I wanted to learn from them. And so that's where it all started. And as you mentioned, me now working with the Alter program, which is a dementia-friendly congregational program. So we work with faith communities to create these dementia-friendly faith spaces within the particularly within the Black community. And I mentioned earlier, right, I'm a woman of faith. So that means I have grown up in the church. I've always known, even when I walked away, when I was in trouble, I go back to the church, right? I know we got some pastors on. We always come back to the church and we seeking guidance and advice. And so as I was doing this work, I will tell you, someone said, "Oh, you can't focus on religion. No one cares about that." And so I listened to them in the beginning, but every time I met with families, y'all, they kept bringing it up. They kept bringing up how important their faith was, how important church was to them, how their pastor didn't understand what was going on, how now they was hurt because the pastor passed right in front of them, right in front of their house and didn't even stop by just because they can't come to church anymore or they're not tithing like they used to. And so these are the things that I was hearing. And when I moved to Atlanta in 2016, I got out in the community and, just was talking to people at the bus stop and just was going everywhere just to learn what's going on here. And I ran across one pastor said, "You need to start at the church." And I ignored him. I would be honest with you all. I was like, "No, I'm not doing this." They said, I can't go nowhere with this with my career. And then my Bishop Allen in Fayetteville, Georgia, called me into his office a year into me moving to Atlanta. And he said, "You need to do something in church. What do you want to volunteer for?" And I said, "Nothing, nothing, nothing. I don't sing. I don't get to church in time to be nobody's usher. And I don't do kids. So what?" And I was very clear with him. He's like, "What do you do?" And I said, "Well, I do older adults, particularly with those affected by Alzheimer's disease and dementia." And he said, "What is that?" And I went on to tell him, he said, "Make that your ministry." So I laughed because I'm like, no, I just want to sit in the back pew and pay my money and just be gone, be done with this. And I shared that with some of my team members that I was working with, my colleagues, and he had told me, "Put a ministry together, put what you want to do." And I put it together, y'all, and it started off with us just educating faith communities, asking pastors to open up their door for us to come in and educate. Then one of those days, a bishop stopped me in the vestibule of the afterwards, and he said, "What am I supposed to do with this education?" And I did not have an answer for him because I thought educating was good. Like, I'm doing great. But he said, "How I'm supposed to respond to my deacon who looks in the mirror and tells me, who's this stranger staring at him?" And in my education, it was more awareness, but I didn't give true tools and tips on how now our leaders in our community can really help someone. And that was when Alter was truly birthed. With that statement, I took my ministry to the next level, asked my colleagues, "Are y'all on this journey with me? Let's do this." And they said yes. And we've been doing it. I will tell you, this is just more of my ministry. And for all of those persons in the beginning that told me I would never get support, never get funding, working with faith communities, focusing on religiosity, they were wrong. They were wrong, because this is part of God's plan. Is for us to be able to use our skill set to be able to serve his people. And he has given me, I would tell y'all, some type of skill set that I'm able to share with sponsors how important faith communities are, how important patients living with dementia, their caregivers, their faith is. And we have to put that in the plan of care and recognize it. We cannot overlook that.
Wow, that's just amazing. Thank you so much for sharing that. I could listen to you all evening. But we have a few more questions, and I know I have a lot of folks wanting to ask you questions, so I'm going to try to get through my interview so they can ask you, because they're coming fast and furious. So
I'm gonna keep my answers short then. Go ahead.
you're good. You're good. I mean, it really is a blessing to hear you talk. So I don't want to negate that either, or kind of clip that too much. But so the next question is, when you think about the intersectionality of communities of color, Alzheimer's disease, there's challenges that we face within our community and that whole intersection between the disease and these and diverse communities, particularly Black and Brown communities. What has been your biggest challenge in that intersection, and how have you addressed it?
I get challenges every day, especially right now, y'all. Oh, daily, daily, daily. But you know, I think how can I say this? There's certain challenges. When I first started off, it was people not recognizing that this was a crisis, especially even within the Black community. Them just saying, oh, this is nothing, them not recognizing that, no, this is something that's happening. We need to do something about it. And the way I address that challenge is I remain persistent. I kept showing up. I kept making phone calls or emails or whatever in a respectful way, right? Not a nagging way. Now, some people may say I nag, but it's out of love, y'all. It's out of love. But I knew how important this was. So I would say that was one of my biggest challenges, especially when I was working with faith communities and letting them know what is actually happening here. I do research, as it's mentioned on the screen, that I am a nurse researcher. So while I was out in the community, y'all, I heard from families and caregivers saying, my experience is different. All of these resources you're giving me is good, but it's not relatable. It's not speaking to me. It's not speaking to the fact that I cannot find a doctor within this certain radius. I cannot find healthy foods. You're telling me about promoting brain health, but we can't even get to the store, And it was things like that. I'm not worried about going to Paris. I'm worried about putting food on our table. And so as a result, I say, you know what, I cannot solve this alone, but I can create something just to help. And I created a course called Caregiving While Black. And so again, that's me trying to address the unique experiences of Black caregivers as they're caring for someone living with dementia. And that's one of the things is we have to acknowledge that there are unique experiences and not just keep on pushing it to the side. So everyone with different backgrounds, you bring these different experiences to the table. And we need to acknowledge that and help you navigate this. How does that look for your home life? How does that look when you engage with the doctor? How does that look for self-care, right? Because in the Black community, it's getting better now, but receiving counseling or therapists beyond just talking to the pastor wasn't really the norm. But now we're doing those things. And so that was one of the things that I did to kind of address these unique experiences. And now recently people are paying more attention to the work that we're doing. And I will tell you all, I'm just going to stay steadfast because people are saying, oh no, you're not going to invite all. This affects all. And I've had backlash on social media. Maybe when I first started, people used to come and get in my DM messages, because this affects all. But we're forgetting the fact that there's certain communities, their experiences are different. And they would need a tailored type of education, a tailored type of support to have a better quality of life on this journey. And that's what I'm going to continue to recognize and do and work with all communities, but recognizing the fact that there's certain groups with specific experiences and backgrounds that would affect how they receive care or how they support their loved one. So I had a caregiver this Saturday. We have these Caregiving While Black sessions, and she stood up at the end and said, so what you gonna do? And I was like, what you mean what I'm gonna do? We're gonna keep doing what we're doing because you still a caregiver, right? Right. So that means you still need my help. You still need my support. And we're just gonna band together and move forward to make sure you have the tools that you need so you can get the care that you deserve, but then also the care that the person you're caring for deserve as well.
Thank you for that. I have two observations. One, I want to make sure folks have access to you. When you talked about the caregiving session that you did, can anyone attend? Is it in person? Is it virtual?
Yeah.
Can anyone attend it?
So first of all, it's part of a study. So yes, people gave me money, y'all,
Yeah.
to do this. It has been funded by 3 sponsors. And we have an all online course that is currently open. And then we have one where we meet weekly to reinforce the material that caregivers have learned. And that one's closed for right now, because that one we had an overwhelming response. We didn't think people was going to take out time to meet with us weekly, but they have.
They did.
So I will make sure I have that link and you can share it in a follow-up. But yes, we're still recruiting. So it is part of a study. Our goal is for it to be scaled out, but we provide support, honorarium for caregivers who participate in the pre and post surveys. And it's a 2-month course that you can take at your leisure. You just need to have access to internet. And then you'll be able to go in and learn about, what do I need to change? How do I manage a doctor's appointment? Because you got 15 minutes. I heard
Yeah.
you just decreased it to 13. So, but you got 15 minutes to get your agenda, and the doctor also has an agenda. So y'all got 15 minutes to make it happen, make it do what it does. And so we are actually addressing those things. Let's talk about that. We're also talking about how Black people feel as soon as you go to the hospital, they're trying to throw me out. And that's not the case, but y'all know we've heard that a lot. I was a nurse, I heard it. You just want to get me out of here. But we explained to our caregivers that the hospital is like a flight. It's to get you from point A to point B. You don't want to be on a flight for 12 hours, 13 hours. And so we break it down like that. So again, addressing some of this cultural messaging that occurs in Black communities and making sure we provide facts and education and rationale. So now we can better understand the healthcare system.
I love it. It's time for Q&A. I'm getting notes.
Oh,
We
is
got
that,
it.
oh,
But I have one more point. I'm sorry, I'm
okay.
gonna be selfish. It's a small question. So I love what I heard from you. I'm gonna kind of bring it all together. What I heard from you is that we have to own and communicate on what's going on with our family. If we're gonna want help and to really try to address this and have a village support us in that effort, we have to communicate about it as well. So I love that we have a part to play in this. The other piece I heard is you talked about access to care. We know that there's some systemic issues in and access to care and disparities as it pertains to people of color. Access to care being one of those, education, health literacy. So we have a laundry list of things we can talk about as far as that's concerned. What do you believe how do you believe we should address those systemic issues? And I love the fact that you pointed out what we can control ourselves, but then also, how do we deal with some of those how do we deal with those built-in systems?
Yeah, and so it's not a one size fit all, right? And so what I may share with you all may not work for all. But again, it is, if you equip yourself, right? Gain more knowledge about how the system works. When you do engage with the healthcare system, you're going to be more equipped. You're going to be empowered to be a better advocate. And that's where it's all about. Once you know all the things that is happening, the new guide model that just came out, you have to take the time to learn about these things and see how this meets the needs of my family. And so when you engage with the doctor, you can come and say, hey, I learned about this. Bring your resources. And we have to do it in a way, how can I say this? That is informing, right? I have some caregivers that come and it's really, they're attacking their providers. And we have to understand our providers are working within a system. So most of the time, they're not the enemy, they're just within the system. So try to look at trying to partner with them. And with that being said, you need to bring some education with you, bring some resources, y'all. Even as a nurse, we don't know everything. We don't. And so we are leaning on you to make sure that you share some stuff with us so we can come up with a better plan of care. So I think the more armed we are with knowledge, it's just how we can really work around those systemic issues that exist. And it's not easy. I know it's not. And it's going to take time. And this is where that village comes in. And this is where when you talk to others, they're going to tell you, oh, I did it this way. Oh, I did it this way. And you can see what works best for you. So, Deanna, as we wrap up and go to the question and answers, I just want to let y'all know when I work with our faith communities, I'm working with them to fill in that gap that exists in many communities of color. I want them to fill it in, bridge that gap, and create a system of dementia care. And so our faith communities are creating supportive programs, respite, memory cafe, education just for caregivers, support groups. They're doing education and awareness, but then they're also creating ways to spiritually connect with these families while promoting brain health. So I just want to let y'all know that is the gist. I have partnered over 5 years. We have partnered with 100 faith communities, 105 faith communities. Wow. And some of them have been alliances or districts, conferences, depending on the denomination. We're across 13 Christian denominations in 21 states and 58 cities within those states. And so for those that are faith leaders on a call, or if you belong to the church and you're going to be like, they need to get with Dr. Epps. Yeah, that's what you say. Y'all need to get with Dr. Epps. We are here and we're welcoming faith communities. My goal is to build the capacity of our faith communities to address the needs of their parishioners and the communities that they serve around dementia. I want to make sure, I'm not going to say I'm holding the church accountable, but I'm making sure that you have the resources that you need so you can support these families. And I will put a plug in for the summit that's coming up April the 10th through the 12th that will be in Atlanta. It was mentioned earlier, we'll be doing this every year, and I invite you all. It is for faith leaders, caregivers, persons living with dementia, healthcare professionals, researchers. Y'all, we're coming together because we have too much skills, too much talent in our community for us not to have the solution. And so we're coming together so we can create the solution. We can learn about the research that's being done in our community so we can make changes. And again, these changes is going to change the narrative. And so in 2050 or 2030, that's the statistic you said. I don't know if we can make those changes that quick. But let's look at the ones that says 2040 or something. Those statistics won't be the same anymore. I've been doing this work for 10 years, but I've been in the nursing field. And when I go back and I look at literature from the 1999, y'all, it's the same statistics. So we cannot keep doing what we have traditionally been doing. We cannot keep depending on others. We have to come together and have these conversations, collaborate together and see how we can support each other, but support the communities who need it the most. All right, we got 12 minutes for questions.
Okay. So I have 2 questions in the chat that I'm going to get from Pastor Thurman. Jason, what I'd like for you to do is, can you flag Tamara Gibson Welch and Linda Larkin Scott? They were very patient and waited for us. I want them to be able to ask their questions. So while you're flagging them, I'm going to jump into
which names again? Sorry.
Oh, the names were Catherine, can you share it's Tamara Gibson Welch and Linda Larkin Scott. And my team can send over those names to you. Joe, I think has them. Okay, cool.
Yep, I just gave permission to speak.
Okay, so why don't we go with them now? Okay, so either one of you jump right in while we have Dr. Epps with us. Are you muted?
So they'll have to accept the request to unmute and then they'll be able to.
Okay, while you do that, I'm going to jump in with some questions that I have. I have one from Frida Merriweather. How do you approach a family member if you think they are having memory problems?
Yeah, so again, that's a difficult question because everybody's different.
Mm-hmm.
And I think you have to recognize their personality and who they are. And so when I work with families, I learn a little bit about who that person is, and that's how you can approach it. So one of the things could be you all do a memory screening at home together and say, hey, I'm testing my memory. I heard from Dr. Epps, hey, don't you want to do this too? And do that. Another thing is I've had families turn on, we do a community forum quarterly, and we do it virtually. And I've had families say, I say, just turn on our community forum, leave it up, do it loud, loud, loud. Because even if they're in the next room, they're going to be hearing and they're going to listen. And they'll hear the things that we're saying. You got to make sure that you're not doing it in a way where you're saying you're accusing someone. So I think you have this and this and this. No, it's just that you are concerned. And that's the way we want to do it. And find out, who do they trust? Is it the pastor that maybe can help and have that conversation with you? I've also had family meetings where I would go and we'll just have a conversation. I had one family, the wife called me over and she had the same issue. She said, there's something wrong with my husband and he doesn't want to talk about it. And I know something's wrong. So I started talking to her. I said, just invite me over. Let me explain to you what dementia is. And I did that at the dining room table, and he was in the living room watching TV. He made his way to the dining room table, sat down, and listened to me tell them what I did and about dementia. And at the end, he grabbed my hand and he said, I have 5 of those symptoms you mentioned. So
Wow.
at that time, and then they were able to get help, and she hugged me so much. So you just don't know what the right approach is. But try multiple approaches, but please do not accuse that person. And I just want to let y'all know there's so many things that mimic dementia that you have to go see a provider to get labs shown. You can have dehydration, untreated urinary tract infection, vitamin B12 deficiency, thyroid problems. I can go on and on and on. Depression. These things mimic the signs and symptoms of dementia. And that's how you want to approach it. You don't want to say, I think you have dementia. I just think something is not right. Let's go get some tests ran. You can have a urinary tract infection. So we want to rule out those things. So
Okay.
hopefully that was some helpful tips.
I like that. I like that you said that it's multiple. It's different approaches. There's no one size fits all approach to this, and you have to try different approaches based on that individual. So thank you for that, Dr. Epps. I have a question from Pastor Thurman. He said, is it possible to establish a national hub for information where you could click on your state, then your city, and it would give you the information resources closest to you?
Yes, so Reverend Thurman, I believe something does exist like that, and I'm gonna try to look it up and put it in the chat or answer your question. But it always can be better, and we can always have more than one national hub. And I don't know if you're adding that to my list. I'm not sure, but I'm gonna put that back on Deanna, and maybe we can work on this together.
I'm gonna work on, I think that I'm going, because Pastor Thurman is not letting me get away from this question. So I am going to 100% work with you and try to get us some funding so we can do this. So I 100% am gonna do that because Pastor Thurman is not letting it go, and I don't blame him. So also, again, from Pastor Thurman, also, is it possible to post the upfront markers, if any, that can be noted before a diagnosis has been rendered to get to the doctor's appointment to start early treatment?
Yeah, so if I'm thinking with that question, you're saying the warning signs, maybe things that we may see beforehand, and then that information we can bring to the doctor. And so again, it's mybrainguide.org is one of the things you can do. It's a memory screening you can do in the privacy of your home. You don't have to put any personal information in, no money, nothing. Okay, it's mybrainguide.org. And if someone asks you for money, you're on the wrong site. Because remember, y'all, Alzheimer's disease is a money-making, it's a lot of fraud and scams in this. So just really be mindful. And I'll put this somewhere in the chat and can be included in the follow-up email. But there are 10 warning signs. And this is what you would bring to the provider. If your person has 3 or more, you want to be really concerned. And so that is the short-term memory loss. So that's what happened yesterday, this morning, 5 minutes ago. Not what they did when they crossed or when they was on the yard. They're going to remember that, okay? And so challenges and planning or problem solving. And so that is trying to get throughout your day. And you'll see them just having some problems. Like my mom, I'm watching her because she hoards a lot. And I asked her what's going on. She cannot process. It's too much. It becomes very overwhelming for her. And so she can't get on to the next step. So that's an example of that. Difficulty completing familiar tasks. This is that person, every morning they get up and make coffee, y'all, with their eyes closed. And all of a sudden, they at the counter with the cup and don't know where to move the cup or what to pour in the cup. Those are familiar tasks. I had a pastor that told me his deacon was his handyman, and he caught his deacon with the hammer in his hand and the nail in the other and didn't know what to do. And it happened just that quick because he had been working on the floors all that morning. So that is familiar tasks. Those sweet potato pies that used to be on point. Now we missing a little something. Y'all, those are familiar tasks. Confusion with time and place. I'm gonna stop giving my examples because I can go on and on. Trouble understanding visual images and spatial relationships. So this is where maybe accidents occur because they lose their peripheral vision. And then those spatial relationships, them not being able to say, oh, that's a black rug. They don't see the boundaries. To them, that looks like a black hole. So new problems with words, speaking or writing, that happens a lot with frontal temporal dementia. We didn't mention this, but there's over 100 types of dementia out there, y'all. Frontal temporal dementia is where they may have problems with speaking, getting the right words out, misplacing things and not being able to retrace your steps. So everybody on this call, I know y'all misplace stuff. I misplace stuff all the time. I just found my AirPods that I had bought some new ones. I was like, hey. So we misplaced, but I was able to retrace. If I was patient, I would have saved my money, but I retraced my steps and I found them. But the problem with someone living with dementia, they will never be able to retrace their steps. They can leave out the room, come back a million times. They're never going to remember what they came in for. Where someone else that's just burdened with stress, when you walk out and you come back in the room, it's going to eventually come to you saying, oh, I was coming to get some water or something like that. Decreased poor judgment. This is where a lot of the fraud happens. So them knowing, hey, this is right or wrong, they can't filter that anymore. Withdrawal from work and social activities and changes in mood and personality. So that person that has been sweet all their life, now they're cursing, now they're becoming verbally abusive, physically abusive. These are the things that you may see. And for my leaders on the call, families will come to you with this. Some of them may want to say, I want to get divorced because this is happening, but we really want them to make sure things are okay. Because if someone starts hitting you, of course you're going to want a divorce, but they may have a medical condition. And we actually had a caregiver husband put her in the ER because he became physically abusive and people didn't believe he had dementia. And he had the frontal temporal dementia and he was in his 50s. And he didn't fit the picture of what most people think. So again, y'all, if you have 3 or more of these things on this list, you do want to follow up with a provider. Make sure it's not any other conditions and get further workup and test. So hopefully, Reverend Thurman, I know that was a long response to your answer, but hopefully it helped you and then help others as well. And that mybrainguide.org, you can print out, it'll tell you if you have a concern and you can print that out and bring that to your provider. And if your provider says that's a scam, you're too young to have anything related to dementia, you go find another provider. Dementia does not discriminate with age, gender, or race, y'all. So, I know some probably people have met people in their 30s. So, and we get vascular dementia in communities of color. So if you have hypertension, has strokes, that runs in your family, diabetes, and you're not controlling it, you're putting yourself more at risk for vascular dementia. And in our college students, they're having strokes now, y'all. So when they get to their 30s and early 40s, if they didn't take care of themselves, they're going to start exhibiting signs and symptoms of vascular dementia. So again, this is happening in our communities across the lifespan. It's not just for old folks.
Dr. Epps, I greatly appreciate you. You have been so informative. We didn't get to all the questions, but I do want to show the promo video for Alter. Like I said, my team member that went last year said it was the best conference she's ever attended. So that just speaks to the quality speakers and the time and the love. You can tell from this interview that Dr. Epps just gives so much of herself into what she does, and it's all for love of her community and to really combat this disease, but support community and helping them deal with this disease. So my hat's off to her. I'm so grateful that she shared her time with us this evening. I know she's super busy. Just grateful to know her and that she agreed to be a part of this discussion this evening. So thank you so much, Dr. Epps. Please don't go. I want to share with you the promo to Alters Conference that's going to be held in Atlanta, Georgia. What's the date on it?
April the 10th through the 12th, y'all. And then we bring in youth too. So we didn't talk about that, but as y'all listen, we have youth involved in this summit too, because they are caregivers as well.
And I'll tell you, Dr. Epps, that was one of the questions. So I'm glad that you said that. That was something someone raised about the youth. So I'm going to go ahead, unmute this and play this video for everyone to see.
What a friend we have in Jesus.
Think of a program that is connecting the dots for people living with dementia, their caregivers, and their spirituality.
My name is Fayron Epps, and I'm the founder of Alter.
We thank to God in prayer.
Deanna, the volume went away.
It went away.
Yeah,
Is it
so we
back?
might-
Can you hear it?
No, they can just see
No?
me dancing, and they see Micah Stampley clapping, but no
But
music.
no volume?
Yeah, so we can just share it in the follow-up. But y'all
Okay,
see the
I'll share
energy.
a link.
I'm one of the staff pastors
Because
here at
I'm
the
hearing it.
AlzInColor
That's
event.
weird. Okay.
We
All right.
are
I can
We'll
hear it
share the
now.
link with everyone. Let me pause it.
with
We're going to share it, Dina, in the follow-up email.
Perfect. Thank you so much. Okay, well, I'd love to thank our guest speaker. She was dynamic, amazing, just everything with what she was. So thank you so much, Dr. Epps, for being here with us. Thank you to our advisory board members. You all really make this possible. You hold our feet to the fire and you really drive the work that we're doing. So we're so grateful to our advisory board members. And thank you, our webinar participants, those of you that took time out of your busy evening to share that with us. We are so grateful for you because we know that you are just an extension of our community and that we will meet the goals that Dr. Epps talked about by the year 2040 rolls around, where we can show that the work that we are doing, the education, the information we're sharing will be impactful to our communities. So thank you all so much for being with us this evening. And we look forward to seeing you next month or the following month. Have a good one, everyone. Good night.